Ushirika began some time back in 1994 as a community health clinic. It was a day clinic where people used to come and get health services. And as we went on, we saw the need that was there, and over time we've been providing services that are akin to what the community requires. In the year 2018, we realized that members of the community, some members of the community, or a majority of them, were not being reached by health services at the time that it is required. What people do due to poverty is that they wait too long before they seek medical services. People are hoping that they will get well and keep staying in their homes even when they are sick. But then when it gets worse and they cannot manage it anymore, that's when they run to hospitals. That one makes it very difficult for them to get adequate health care, and even makes people die, because when people stay with the diseases in their body for a long time and are not taken care of at early stages, they get worse, they get complicated, they get too expensive to deal with. So we realized this was becoming a big problem in the community, and we introduced the Young Community Health Champions program, where the youth move from the facility where we are into the community, looking, or rather enlightening people about the diseases that are there, about ailments, about how to keep healthy, about how to keep their environment, to avoid diseases. And in this, they are able to identify sick people at very early stages when the ailments can be managed. And this has helped a lot and increased the flow of people into the facility, and not necessarily them coming to our facility, but even it helps people to go to other facilities, because we are not taking care of all the diseases that people have. But then these health volunteers would go there and create awareness to the people. You would even find cancer patients sitting at home and not doing anything about it. So these community health champions would go out there and advise them where else they can go to seek treatment. If somebody is suffering from diabetes, what do they need to do? If people are suffering from hypertension, very many people are suffering from hypertension and they don't even know. So when these health champions go to them and talk to them and advise them, then they come for checkups at the facility, and then they are advised on what to do. And again, something rose up as we were doing this, and we realized that majority of them, since our facility, we require them to pay something so that they can get services. Since we buy the item, the equipment that we use, the drugs that we use, we buy them. So we realized that a lot of these people come to the facility and they don't have any money. And since they are referred by our own young community health champions, they expect that when they come to the facility, they would get free services. And this has been a big challenge to us, and we realized that we needed something that would help or would support these members of the community to be able to get health services that they need. And this is how we identified the TIBA Fund, where people are able to contribute to this fund and then be able to get health services when they need, rather than waiting until they are sick, then trying to get money to go for treatment, which is very, very difficult in the community where we work, because majority of the people are either unemployed or underemployed. So it is very difficult for them to get money or that is required to go and pay for health services. They need money to put food on the table. So even that one of putting food on the table is not there. So getting money for healthcare is very difficult, and especially when somebody else is supposed to pay for this healthcare, and maybe the head of the family is supposed to pay for the healthcare, and there is not enough money, there is only money for putting food on the table, so it becomes very difficult. So we introduced this TIBA fund, and it is something that would help a lot, except that there are not many, the people don't have money to be able to be deposited there. The TIBA fund is a sort of a sustainability mechanism because what the small amounts that the community members would pay or will contribute towards this fund helps us to sustain the work that we do, even with our young community health champions, so that they can be able to get some stipends from these funds to keep us running our programs. And we believe, we've seen it to be working very well, and we believe that if we are able to make it better, then many more members of the community would be able to get help through this.